running a little bit late. We got started a little bit late. But I want to just ask the panelists if they choose to jump in and talk about what they would like to see in health reform. Helen did a little of that earlier.
I did. I was allowed to.
You were. And, you know, just quickly, either as individuals or representatives of your sector, and then I want to open it to everyone. Judd.
I'd like to just share a couple of thoughts. This system is extremely complex. It's 17% of the gross domestic product. There are huge numbers of people who have specific motivations in this system to do certain things. Every action in this system will have unintended consequences. It's fine to talk about our intentions, but I think we ought to be careful about what might happen that we might not want to happen. We've already done it a number of times for the last several decades in healthcare. It's probably why we are where we are. We are trying to reshape something that is a social service, medical care, and we don't have a common set of principles that we're working from. Now, maybe you all are comfortable with Congress establishing that common set of principles, but that's what we're working from. We don't really even have a common set of definitions. We talk about universal coverage. Does that mean every service for everybody, or some services for everybody? What's a single payer? Is Medicare a single payer for those over 65? It comes from the same place. Do they pay the same price for the same thing? If you get a colonoscopy in New York or New Hampshire or Maine, is the provider paid the same price as a single payer? No, they're all different. They're different. So we're not really even dealing with a single set of definitions. Public versus private. I don't know. It puzzles me. What's the debate? We got a public-private system now. We got Medicare and Medicaid. As Chris said, Medicare is the biggest provider in the country, and we've got commercial insurances. What are we arguing over in public-private? Because we don't even have a common set of principles there. Myths. Number one, there is enough savings or waste in the system to pay for reform. Yeah. Second myth, the coverage for the uninsured will lower the cost of care. Now let me think here. If being uninsured creates a barrier to use the system, and we're going to remove that barrier, so we're going to improve utilization of this system, do we think that costs are actually going to decrease? It may decrease commercial premiums, the price, but not the cost of our health care system. Reform, no matter how you chop it, as Tom said, is going to cost us a chunk of change. Maine made a great mistake, which we can learn from. Maine decided to put a system in place that would reduce the cost, cover the uninsured, be a great system. There's only one problem in Maine. We didn't figure out where the money would come from. So 6 years later, it's collapsed. It now covers 10,000 individuals. There's about 240,000 in Maine on Medicaid. Myth 3, electronic medical records and public health records will solve most of our issues and save a ton of money. They will cost us a ton of money. They're great for care, they're great for continuity, they're great for exchange of information, they're wicked expensive, and we'll still have many of the same issues. Trying to change this system by October, one fell swoop, I think we're all going to be wicked disappointed. Now, we might not be disappointed in November, but I think we're going to be disappointed down the road. Here's the approach I would suggest.
It will never happen. Because the system is so huge and so complex, why don't we figure out how to commit to the next 5 years and take a piece each year with some metrics, change that piece, and determine after a period of time whether we've achieved what we set out to achieve. Then take another piece of the system and change that and measure that over a period of time. My suggestion is, because if we don't do that, we will change, perhaps, so much that so many variables and unintended consequences that we won't be able to figure out the cause and effect relationships of what we have. And again, in my opinion, one fell swoop.